Well, when you hit that magical range of 50s, and we're talking plus or minus 2 or 3 years, many women come in, the biggest complaint, hot flashes. That's usually what brings them in before anything else. And I would say a pretty close second between vaginal dryness as well as mood changes. Those three get people to the table. We're going to be looking a lot closer at that point to see if you have osteoporosis. We're going to check to see what percentage of increased risk of heart disease you're going to be at. We're going to see, are there other things going on? Is there an increased risk of you having some psychological issues as a result of all these hormonal fluctuations? You'd be amazed at how many options are out there for medications that actually aren't indicated by the FDA to treat menopausal symptoms, but they work very well. We're at that stage when we're hitting those 40s and 50s, metabolism comes to a screeching halt. At least it feels that way sometimes. And as a result, it takes a lot more to lose weight. It takes a lot more to keep the weight off. We have to make ourselves increase the amount of exercise we have. The nice thing about doing those things for women in the 50s who need to focus on just those areas of healthy eating and exercise, it helps many of the problems that are associated with becoming 50 years old. Actually, the exams as they relate to coronary heart disease, they're not very different than the earlier stages in life. They should come in and have their blood pressures checked. On average, if we're talking a typical average risk individual, I would prefer patients personally come in once a year for their annual physicals and at that point have their blood pressures checked. And in terms of cholesterol checks, as a general consensus, I think most providers want to do that once a year. And of course that does vary, if you're higher risk, you have family history, other significant factors can contribute to having that checked much more frequently. Colonoscopy is for colorectal cancer screening, and what's been determined based on the studies is that, hey, at the age of 50, all women should have that screening. There are some key gynecological issues that should be discussed, one of which would be making sure you have pap smears, for example. You tend to get these done, most women want to get them done during their annual physical exams. You can have these done once every 3 years, depending on which set of guidelines that physician follows. In terms of mammograms, it's recommended you get once every 2 years, you have a mammogram done. As you're entering those age ranges of the 50s, again, be okay, be accepting of the fact that you may need to go see your doctor more often. We as women, we tend to be strong, we want to hold out, we're supporting everyone in the family, we're taking care of kids and grandkids and works and community projects. We just get so busy, we never take time to see about ourselves. Just be mindful that at age 50, you may start recognizing that there are certain changes that you weren't anticipating, that you weren't aware of. Start developing those habits so that you can see yourself 10, 15, 20 years down the road, being healthy and being okay with the changes that come about in your body naturally.